Hi everyone, I'm Dr. Robert Avram. I'm a practicing cardiologist and the CEO and co-founder of FrontRx. We have built FrontRx to fix what was broken in clinical workflows: disorganized handovers, scattered patient lists, and disconnected AI scribes. FrontRx combines a collaborative patient list, an integrated AI scribe for structured notes, billing, and e-faxing all in one platform designed by doctors such as myself for doctors and healthcare professionals. It's simple, fast, and built to support the way care teams actually work while preserving privacy. Let's check out a quick demo. So FrontRx works with patient lists. But first, once you have a patient list ready, you need to add a patient. I already added this patient here by taking a photo of the health card or a page from the patient chart. The medical record number, the first name, last name, date of birth is automatically abstracted from it. That's it. The patient is added to your list. Once you click on a patient, you can actually see the details that were added to the patient, and you can use our AI scribe to generate a clean structured note based on the doctor-patient spoken assessment. To do so, you click on the document, you click here on the new notes, you can choose a type of conversation. You can either attach or add a file that represents the patient-doctor recording. We support over 40 languages. You can use here to toggle the conversation language. And then you can change the note template and add additional context. For instance, the patient is known for AFib and for type 2 diabetes. Once you're set, you set a medical note language and you click on Generate Patient Note. A quick word about privacy. We do not store any audio or transcription data. The audio is automatically deleted immediately after transcription, after I leave this page. The transcripts disappear as soon as you leave the session, and the notes and prescriptions are stored only temporarily to support your workflow and deleted after 3 months. We're always in compliance with Law 25 in Quebec and PIPEDA in Ontario, and we're also HIPAA compliant for the rest of Canada and the United States. All the data is hosted securely in Canada for the Canadian version, with patient confidentiality as our top priority. Once you have the medical note, you can review it. You can also edit it if you find that some details are missing or you want to remove certain problems. And then you can either save it and transmit it using eFast or save it on the actual platform. So in this case, I'll put as the consultation. Once the note is saved, you can actually copy and paste the documents to put it in the EMR. You can see here, you can preview the document and you can copy and paste it, or you can e-fax it. The patient lists are separated into 3 categories. So you have active patients, which are patients that need to be seen today, patients that are already seen, and discharged patients. You can drag and drop the patients to put them into the correct category, keeping in mind that tomorrow the seen patients, you might need to reroute them, so you can click on that button and transfer all the patients to the active patient group except those that were discharged. FrontRx is built with collaborative features in mind, so you can actually share the patient list with team members such as nurse practitioners or students, and they will all be able to see the patients and divide and conquer basically to ensure a continuity of care. You can also export a patient list for handover. A patient list that's exported for handover will contain information about the patient, the admission diagnostic and date, the past medical history, the current medical history, as well as anything you need to follow up on. Finally, for those that are residing in Quebec, you can actually add billing to each patient. For instance, if you want to bill a consultation, you can do that here as well. Thank you very much for listening to this demo, and I'm really excited to see what you do and with FrontRx and how you use it in your clinical care.